各位媒体朋友，大家下午好。根据北京新冠肺炎疫情防控工作领导小组的安排，今天我们召开第319场新闻发布会。
Friends from the media, today is the 391 session of the Information Office of the Municipal Government to brief you the prevention and control as well as the latest results of the COVID-19 pandemic in Beijing. After 2 rounds of the new PCR test in Beijing, we believe there are some of the new risks in terms of the transitional chains in Beijing. We should bear a clear mind that this is a critical moment for the prevention and control of COVID-19 pandemic in our capital. We should stick to the zero COVID policy and use a strict measure to fight against every second, to adopt a more serious attitude and more strict measures, more quick actions to fight against the virus and control the potential key areas and also the key risks. And this is also going to be a critical measures that we are going to take to fight against the virus. And this is our battle for life and death, and we need to make sure the safety and security of our citizens. We are going to stick to the principles that we are going to screen all the citizens in a quick manner, and we are going to control the risk areas in a timely manner, and we have organized a district-based PCR test. We should also eliminate the potential risks. While we are coordinating different PCR tests in the different regions, we are also going to strengthen the coordinations between the collecting of the PCR results, the collecting of the PCR samples, the delivery of the PCR tubes, and also the final result of the PCR testing in the labs. We should also strengthen the management in the schools and also do a good job in the prevention and control of COVID-19 in the schools. At the same time, we should also keep a very good and smooth logistic in our city. All the supermarkets, agri-markets, and also the e-commerce platform is going to enhance the delivery times and extend their working times. This is also going to help the food package in the city. And we are also going to strictly measure these different districts. This is also how we are going to guarantee the daily life of the citizens for the areas which is related to the COVID-19 pandemic. We are also going to help the citizens. Currently, all the daily materials and also the daily necessities in our city is supplied in an adequate manner. We should also fully shoulder the responsibilities for each of the personnel. Since we are entering into the Golden Week holidays, we are calling for the citizens to do not leave Beijing, and for those who is going to arrive in Beijing during the Golden Week holidays, please bring a PCR negative testing result within 48 hours. And please to report to the hotels and the communities. Within 48 hours and 72 hours, there's the second round of the PCR test. And after arriving in Beijing, there should be no gathering, no parties, and for all of those relevant institutions and staffs, before entering into Beijing, 48 hours, they should have 1 PCR test, and after they arrived in Beijing, they should stay at home. And if there is any symptoms, including the fever and cough, they should come to the fever clinics according to the requirements. For millions of the citizens in Beijing, you are the major force during this battle against COVID-19. You are the most respectable and adorable people in this battle. I also want to thank the netizen Shui Muding. He is living in the lockdown area. On the 28th of April, he actually wrote one blog recording these waves of the COVID-19 pandemic in Beijing, and he also interpreted the policies in the lockdown regions and also for the lockdown communities. He strengthened that we should adopt a rational attitude toward this wave of these attitudes. We also want to thank the netizen for his interpretation, understanding, and support of the COVID-19 prevention and control measures in Beijing. We are going to continue our interpretations for this round of the COVID-19 pandemic, and we are also going to carry out the policies of the prevention and control of COVID-19 pandemic. Today we have here with us
北京市疾病预防控制中心、朝阳区人民政府、丰台区人民政府、房山区人民政府
the representatives from the CDC Beijing, Chaoyang District, Tongzhou District, and among other different officials. Now I'm going to introduce them one by one. They are
肺炎疫情防控工作领导小组检疫检测工作组副组长。
The deputy directors of the quarantine and screening sectors of the CDC, Mr. Li Yang, and also the deputy director of Chaoyang District, Mayor Yang Beibei, and deputy mayor of Fengtai District, Mr. Bo Ran, and also Mr. Yu Chenfei, who is the spokesperson of Fengtai District, and Mr. Tang Yiyuan from the Shunyi District, as well as Madam Pang Xinhuo, who is the chief scientist of the CDC Beijing. First, we are going to give the floor to the deputy directors of the National Health NHC Beijing, to Madam Pang Xinhuo, to report to us and bring to us the latest development of the COVID-19 pandemic in Beijing. Dear friends from the media, good afternoon. Let me report to you and bring to you the latest information of the COVID-19 pandemic in Beijing, as well as the healthy reminders. By the end of the 28th April, as well as the 29th of April, there is a newly reported 34 cases of the COVID-19, among which 31 of them is confirmed cases and 3 of them are asymptomatic cases, 12 cases in Fangshan District, 8 cases in Tongzhou, and 7 cases in Chaoyang, 5 cases in Haidian, and 1 case in Daxing, 2 cases which were screened by the communities, and there are 28 potential risks for the 12 different persons in Fangshan District. Number 377, living in the Yuzhuang village of Doudian town in Fangshan District. He was discovered through the community screening, and he was confirmed at the 28th of April. Mild case. The number 378 case, living in the Doudian district, Doudian town of Fangshan District, belongs to the mild cases. Number 384, in the Yuzhuang village of Doudian district of Fangshan District. As a potential risk, he was diagnosed as a confirmed cases, belongs to the mild cases. Number 385, lived in the number 8 building of the Tuyuan Chunjing. This is a primary school student. He or she was quarantined at home, and he was diagnosed as mild cases. Number 353 is currently living in the Wanchu village of Doudian district of Fangshan. He was officially, this patient was officially diagnosed by this morning. The number 398, the patient is a staff of the Dalian Huoshao restaurant. The patient was diagnosed as an asymptomatic case at the 29th of April. Number 395 case is currently living in the Doudian town of Fangshan District. On April the 28th, the patient was, the case was controlled, and after several rounds of the PCR testing, he then was confirmed case. number 401 case was confirmed at 29th of April. Number 359 is the father of the number 204, and he is currently living in the Doudian district. As a close contact, he was diagnosed and confirmed belonging to the mild cases. Number 366, number 362 is the family member of number 328. The two cases was quarantined because of the epidemiological contact. Number 365 is the family member of number 266. They share the same household, and after a generalized quarantine, the patient was diagnosed as a mild case. Then I'm going to bring to you the 8 confirmed cases in Tongzhou district. Number 388 is living in the Xintong Jiayuan number 4 building in Tongzhou district. The case was discovered by PCR test, mild case. Number 384 is currently living in the Zhongtang district, Beicheng Jiayuan number 6 building. On the 24th of March, he has visited the Jingmou Trading Center. He was quarantined at home and stayed at home. On the 28th of April, he was diagnosed as a mild case. Number 347 is currently living in the Yutiao district of Yutiao street of Tongzhou village. The case of the patient is sharing the same workplace with the case number 287 and was diagnosed by the PCR result as a mild case. The case 284 is working at a cosmetic shop. For the number 287 came to the shop and bought some of the cosmetics. As a close contact with the confirmed cases, after several rounds of the PCR test, the case was also diagnosed and confirmed. Number 333 is a school student and quarantined for the close contact. The case was officially diagnosed as a confirmed case in the 28th of April. Number 357 is the mother of number 356. She was officially diagnosed on the 29th of April. Number 358 is living in the Jiukeshu district of Tongzhou district, a school student, as a close contact with number 220 on the April 28th. The case was officially diagnosed and confirmed. The number 269 is a close contact with number 328. On the April 28th, the case was confirmed and belonged to the mild category. Let me bring to you the latest information in the Chaoyang district. The number 338 patient is the father of the patient number 344. The case was living in the Songyudongli district of Songyudongli community of Chaoyang district. Number 338 is working at a construction and greenery firms, and he is a close contact of the number 338. Number 341 and number 342 is living in the Jianwai district. Number 10 building of Guanghuali district house residence. They are working at the Huangmenji restaurant. And they stay at home for the quarantines and officially confirmed as the confirmed cases on the 28th of April. For 342 is living in the Jinzhan district and Jinzhan Jiayuan number 8 building. And these confirmed cases was screened by the community on the 28th of April. The case was confirmed and belongs to the mild category. Number 349 is living in Chaoyang District, Shanggu, Huancheng, and he's working as a part of the construction team. After centralized quarantining, the case was confirmed, belongs to the mild category. The number 348 is living in the number 6 building of Hongbo district, and as the areas and through the community level screening, the case was confirmed. There are 5 cases in Fengtai district. For the case number 366, 369 is the father and uncle of the number 338. They are living in the Zhaoxingdian district of Changxingdian areas. And on the 28th of April, he was confirmed. On the 349, they are living in the Changxingdian district of Zhaoxingdian village. They are close contact with number 184. They are confirmed as a mild case on the April 28th. Number 336 is living in the Fengtai district. Sifangjing, number 3 building of Sifangjing, the 28th, and he is working as a kindergarten and as a close contact with the 268. On April 9th, the confirmed cases 345 is a close contact, and he is diagnosed as an asymptomatic patient. Let me bring you the 5 confirmed cases in Haidian district. The number 335 cases in Haidian district is living at the number 3 building of Haidian building as a close contact with the number 160. On the April 28th, he was confirmed and belongs to the mild categories. And in the Daxing district, there is 1 confirmed case. The number 386. He is a close contact with the confirmed 344 case. On April 29th, he was confirmed as a close cases. On April 28th, in our city, we have reported 228 COVID-19 pandemic patients, which is closely related to 12 different districts. There is 110 cases in Chaoyang district, 12 cases in Shunyi district, and 11 cases in Fengtai district, and 10 cases in Haidian district, 2 cases in Xicheng district, and 2 cases in Yanqing district, and 1 case in Dongcheng district, 1 case in Shijingshan district. Currently, we are facing a critical period for the prevention and control of the COVID-19 pandemic. We should screen and rule out all the potential risks. At the first time, we should deal with it to use the best measures to deal with the prevention and control of the COVID-19 pandemic. Here we remind all the citizens, please report to the close contact. And if there is any reminders of the Beijing Health Code, please report to the communities. And during the COVID-19 pandemic, the medical workers, the workers at the communities, and also the police officers is going to work at the front line of the COVID-19. They are working at a heavy workload, and especially who's working at the community, they are under severe workload, and all the citizens should support the frontline work while coordinated with the COVID-19 prevention and control measures. After a close medical screenings, we should observe all kinds of measures, and if there is any discomfort in their health, please report to the communities. The Golden Week holiday is approaching. Please stick to the principles and do not leave Beijing, and reduce the influx and outflux of any personnel. And if there is any shopping in the public areas, please scan the QR code and test all the relevant measures. And if there is any fevers or any symptoms in the respiratory tracts, we do not advise you to go to the public areas. Let us join our hands and safeguard the security of the capital city of Beijing. This is the information for the affected personnel. I'm going to bring to you the latest information about the prevention and control areas of our city by the 28th of April 2022. In the Pajianyuan district of Chaoyang district, for the past 14 days, we have reported 6 confirmed cases. According to the evaluations of the prevention and control centers of our city, currently, we are going to list the Panjianyuan district in Beijing as the upgrading the area from a middle risk region to the high risk regions by the 28th of April. For the Fangshan district in the Beijing, for the past 14 days, we have reported 2 confirmed cases. According to the evaluations of the Beijing city, and according to the requirement of Beijing city, in the recent days, we are going to upgrade the Liulihe district of Fangshan district from a lower risk region to a high risk region. And by now, currently, there are 6 high risk areas in the city: Panjianyuan Street in Chaoyang district, Songyu district, and also the Songyu Xili communities, and also the Zhoujiazhuang village, as well as the Fangjiayuan district, the Fangshan district, Yuzhuang village, Doudian Diandu Shiji Mingyuan communities. There are 19 different regions. They have the Panjianyuan district of Chaoyang, Panjianyuan Street of Chaoyang district, Fatou Xili communities, Sandianfang village, Yishui Fangyuan communities, Nanxingyuan community, Hongshan Jiayuan, Shibali Dianxiang, and the middle town of the Shuangjing Street, Guanghe Nanli 2条, Fatou 街道, Fatou Xili 3区. And for the Panjianyuan Street, Nanmofang Townships, Balizhuang Street, Hongmiao Beili Community, Shuangjing Street, Huangmushan Community, Sunhe Town, Tangying Township, Jinsong Street, Longguangdongli Community, Fangshan District, Doudian Town, Pingjiayuan Village, Doudian Town, Mayaotou Village, Chaoyang District, Jiazhou Dongli District, Liulihe Town, Xinli. Across the city, the other area remains to be the low-risk region. This brings to you my latest report. Thank you very much. We want to thank you, Madam Pang Xinhuo, to bring us the latest information about the COVID-19 prevention and control. Now we are going to give the floor to the Deputy Mayor of Chaoyang District, Madam Yang Beibei, to bring you the latest information. Dear friends from the media, good afternoon. I am here to bring you the prevention and control of Chaoyang District. By the 29th of April, the newly added cases in Chaoyang District is 7 cases. All of them are related to the confirmed cases, and currently they are transferred into the hospitals. So I am here to bring you the latest updates. The newly added risk areas, and today, by the 18th of April, the Yaojiayuan route is going to be locked from the 0 a.m. to 24 p.m. And on the 24th, the number 9 building is also going to work as the Jinsong South Road, as well as the groceries in the Jinsong South Road. From 7 to 7:10, the number 3 building in the Jianguo Road. On the 8th of the 8 p.m., the 9 to 9:30, the Longguangyuan Market. From the 8 a.m. to 9 p.m., the Songheli Street. From the 30th p.m., the medical and clinics in the Panjiayuan district. From 19 p.m. to 20 p.m., Panjiayuan clinics. On the 30th of Panjiayuan district. From the 15th to the 16th, the Dangshan supermarket, Tiankelong supermarket. From the 18th to the 29th, the Xianmei cake shop. From the 28th to the 30th, the Jingzhan Jiayuan hair shop and hair salons. And from the 28th of April, from 8 a.m. to 10 p.m. on the western district of Jinsong, the number 3 building. On the 8th of the Chaoshifa supermarket, Baihuan supermarket, and from the 14th a.m. to the 40 p.m. to the 15th p.m., the Chaoshifa supermarket. From the 21st to 22, Yaojiayuan number 8 building. And from the 22 to 23rd, Shanshui Wenyuan number 26 building. On April the 23rd, from 8 a.m. to 9 p.m. on the western gate of Jinsong Western area. From 9 a.m. to 10 a.m., the garbage collection area of Jinjiang district. And for the Maojingchang district, the PCR testing areas. From the 12th a.m. to the 7th p.m. On the 18th p.m. to 19th p.m., the Baizhuang district. From the 19th to the 20th p.m., the Chaoshifa Baihuan Jiayuan branch. From the April the 25th, from 10 a.m. to 10:20, the Panjiayuan district Maojingchang areas, and from 11 a.m. to 12 p.m., Panjiayuan South Road. From the 15th a.m. to the 16th a.m., Jianwai district, Guanghe, Dongli PCR testing area. From the 17th a.m. to the 18th p.m., the PCR testing areas in the Hujialou Guangdong supermarket. From the 18th p.m. to the 19th p.m., the number 6 areas. On the 28th of April, from 9 a.m. to 10 p.m., the PCR testing areas. And the Jinke Jiayuan, from the 10 a.m. to 20 a.m., the Maojingchang PCR testing areas. And from the 30th of April, so for those of the personnel who have been to these areas, or for those of you who have received any alert from the Beijing Health Code, please report to your company, or please report to the district government, or diagnose the district government of the Chaoyang district 877, the Jianwai Street, Guanghuili district. The Huangmenji areas has reported that since there are 2 confirmed cases recently, please report if you have been to the areas at 6 a.m. to 7 a.m. If you've been to this area in this time slot. The second point I want to talk about is the positive case. So we have eliminated and screened all the potential cases. According to the latest information, we have screened 1 case and 6 of the patient is suspected. For those of the 2 confirmed, they are the close contact. Yesterday, the Chaoyang Medical Hospital, during the regulatory screening, has came up with a plan and figure out 1 confirmed cases. And for those related areas, they have sampled all the environment. Currently, all the relevant personnel is under control and quarantine. According to the latest COVID-19 prevention control information, the Shibali Dian District, Lujiaying communities, the Dianwai Street, Guanghuili number 10 building, Jinsong District, Nongguangdongli Street is becoming the locking down regions. And for those citizens who is living in this above-mentioned area, they should stay at home. And for those who is living at the southern yard of the Chaoyang District OBGYN hospital, they are also going to be the lockdown region. And according to the latest information, in the next step, we are going to conduct a series of measures. Second, we are going to conduct 3 rounds of the PCR testing. Recently, we have enlarged the 3 rounds of the PCR testings, and for these rounds, there is 1,533 checkpoints for the PCRs. This is also going to help the citizens to conduct the PCRs. Since all the primary schools and middle schools has going through different rounds of the PCR testings, currently we have collected 3,065,000 personnel across the Chaoyang District. We are calling for citizens in Chaoyang District to work together to tackle with these difficult times. So here I want to thank you again for your coordinations. I also want to thank the medical workers, the volunteers, and also the government officials for your contributions. Here I want to remind you, all of you again, the residents living in the lockdown regions, please come to the building and avoid any intertwines. For those of the other personnel, please come to the PCR testing according to the requirement of the workers in the communities. And during the PCR test, you should follow the arrangement on the sites and wear a medical mask. Do not crowd or gather together, and do not smoke and do not talk on the telephone. After PCR testing, wear the medical mask and leave the sites. Thirdly, for the key areas, we are going to conduct a series of prevention and control measures, thinking about the rapid development of this wave of COVID-19 pandemic to contain the rapid spread of this wave of COVID-19 pandemic. For the certain region, we are going to adopt the prevention and control areas for certain areas, including the Langjiayuan community, Jinghui Street, Dawang, to the west of Dawang Road, and to the north of Jingtong Rapid Road, to the east of Hengyuan Donglu, Hengyuan East Road, to the west of the Western Dawang Road, to the east of the Xidawang Road. The measures that we have undertaken, including that for all the nursing houses, they are going to be locked down. For the supermarkets, restaurants, KTV, internet bars, and also the entertainments, cinemas, laboratories, museums is going to stop their operations. For those of the people who is living in these areas, on the 28th of April, on the 1st of May, and also on the 3rd of May, it's going to go through 3 rounds of the PCR test. Please do not go to the outdoors and do not gather up. After there is any alert on the Beijing Health Code, please follow the requirement and conduct all kinds of measures. Currently, there are all kinds of measures, and moving into the next step, we are also going to follow the risk according to the risk of the epidemiological research. currently to make sure that all the citizens is going to enjoy a healthy life and work. All the supermarket is working on a normal manner, and also the delivery services is also working on a properly manners. There is sufficient supply of the day-to-day necessities. We want to thank you for your coordinations. Fourthly, we are going to guarantee a normal day-to-day life. We are going to work together with all kinds of resources to do a good job of the PCR testing, including the medical researches and also the sterilizations of the delivery goods. The medical workers in the communities, and also the volunteers is working day by night, and also the workers at the community is working at the supermarkets as information gatherers, while the deliverman is coming to the communities to select and sort it onto the delivery parcels. I think all of you is going to contribute the fair shares to the prevention and control of COVID-19 pandemic. Across the Chaoyang district, there are 17 different guaranteeing areas where we have stored enough vegetables and meats. And in these areas, there are 18 different newly added sites. We have also coordinated the Meituan vegetable buying Hema Xiansheng among other 12 different e-commerce platforms. On the 28th of April, we have delivered 338 deliveries. On the 28th of April, we have also guaranteed the day-to-day operations of Nanmoxiang district. We have also formed a risk control regions, the medical teams, and we have opened up the 24 hours medical hotline to satisfy the day-to-day demand of the medical transfers and also satisfy the demand of the workers in the emergency rooms, as well the patient who needs the emergency treatment. For those of the patients who is in the urgent demand of the emergency treatment, they are going to be served and with the special personnel, and we have also arranged the special vehicles to satisfy the demand of the patient. At the same time, we have also arranged the volunteers and also the workers to help to buy the medicines for each one of the building and also for each one of the units. We have allocated the buildings informations, and we have also dynamically sorted and controlled the pregnant ladies and also the elderly people, trying to figure out their demands and giving them green channels. And these green channels is going to be safeguarded by the policemen. And this is also going to help with the pregnant women, also with the leukemia patients. Currently, we are at the critical period for the prevention and control of COVID-19 pandemic. Chaoyang district is sticking to the dynamic prevention and control of COVID-19 pandemic, and we are also going to contaminate the spread of the COVID-19 pandemic. And we are also hoping that all the social institutions please do a day-to-day sterilization work. Dear citizens, you should be the first responsible person. And if you enter into the supermarket, hotel, or any shopping malls, please scan the QR code and do not gather up if you come to the parks and also the tourist sites. Please wear the mask according to the scientific requirement. Keep a safe social distance. That concludes my report. We want to thank the Deputy Mayor of Chaoyang District, Madam Yang Peipei, for your reporting. So now we are going to give the floor to the Deputy Mayor of Fengtai District, Madam Bo Ran, to bring you the latest information. Dear friends from the media, good afternoon. On the 18th or the 16th p.m., there is 8 confirmed cases in Fengtai District. All of them is being transformed into the designated hospitals. The first one is about the previous. The first one is about the information for the confirmed cases. From the 20, let me report to you the information of the confirmed cases toward their previous epidemiological sites. On April the 23rd at 8 a.m. to 9 p.m. for the Fanglan Lu restaurant. From the 3 p.m. the Jingxian restaurant. From the 5 p.m., the Beihai Park Yizhuang branch. From the 15th p.m. to the 16th p.m., the McDonald's. From the April the 24th, the medical center in the Zhujiatun. On the 8 p.m., the Zhengda Cunyuan supermarket. In the afternoon, at around 60 p.m., Changxingdian Street. At around 70 p.m., Sichuan Jingyuan restaurant. On April the 25th, from the 70 p.m., the Fangzhuang supermarket. On April the 26th, Zhengda Youxian supermarket. For those of you who has a close contact or any overlapping of these previous trajectories, please report to your community and please report to the government. Or diagnose the number of the CDC in Fengtai District 618636. The second part I want to bring to you is the latest work of the Fengtai District in terms of the prevention and control of the COVID-19 pandemic. After the breakout of the COVID-19 pandemic, for the Fengtai District, we have locked down and trying to close up all the close content of the confirmed cases. And we are also calling for the latest communities to make sure that prevention and control is work. For the 16 different checkpoints, all of these are negative in the PCR testing result. We have also conducted an overall sterilization process. Since the quarantine personnel is related to the small groups, since some of the kids in the kindergartens, we have arranged that each one of the kids is going to be accompanied by one of their parents. We are also going to arrange some of the professional teachers for the kids to make sure that they are not going to be affected by the pandemic. Second, according to the latest development of the COVID-19 pandemic, we have dynamically controlled and relisted all the relevant areas. Currently, there are 7 lockdown regions and 1 controlling regions. It is related to the 8 different streets. There is around 20,000 people affected. We have also came up with a list for these people who need special cares, and we care about the disabled people and also the elderly people as well as the pregnant ladies. We are guiding the local communities to form special teams providing the delivery services, as well as the collections for the garbages. And this is what we do to satisfy the multiple and diverse demand. Thirdly, we have finished 2 rounds of the PCR test. And we are actually winning the battle of prevention and control and COVID-19, while we have trying to marshal up all the forces to fight against COVID-19. For those vulnerable groups, including the pregnant ladies and also the elderly patients, we have delivered the PCR testing on door. At the same time, in order to, we have added 1 antigen testing on top of the PCR testings. Here we remind all the citizens that they can buy the antigen testing on the internet or through the public account of Fengtai CDC. They can follow and learn the antigen testing. If there is negative report, please contact the CDC in Fengtai. Fourthly, with this time slot of the Golden Week holidays, we are going to store the agri-products, trying to figure out the optimized trajectories for the agri-products to enter into the market. At the same time, we are also going to enhance the treatment in the market. We are also going to optimize the activities in the market. Currently, for all the daily necessities, it is supplying in a normal manner and the prices also remain the same before the COVID-19 pandemic. Currently, we are under huge pressure. The Fengtai District is calling for all the party members to spread the spirit of the anti-COVID. Please respond to the requirement in a quick manner and prevent the prevention and control of COVID-19. Thank you very much, Deputy Mayor, for your kind introduction. Now we are going to give the floor to Deputy Mayor of Fangshan District to introduce us the prevention and control measures in Fangshan District. Friends from media, good afternoon. There is 12 newly confirmed cases in Fangshan District. There are 3 cases related to the Dalian Huoshao restaurant and 6 related to the wedding ceremony, and 3 of them is confirmed at the middle and high-risk regions. All of these 12 confirmed cases is within the lockdown region or quarantine region. For the newly added cases, on the 21st of April, at the 14th, the Doudian Huamei supermarket, at 14 p.m. On the 23rd of April, the Hongri supermarket. On April the 23rd, Doudian Chenjie Kunti district. On the April the 23rd, the Sanren supermarket in Doudian district. At 8 a.m. to 9 p.m., Doudian Jiaodao Yijie police station. At 12 a.m., Hongri supermarket. At the 30 p.m. to the 14 p.m., the Liuli He Yaoshang restaurant. At the 19th p.m. to the 16th p.m., the Fresh supermarket. On 24th of April, the Mayfair restaurant. At 6 a.m. to 7 a.m., the Heping Road meat store. At 9 a.m. to 10 a.m., the Dazhun noodle restaurant. At 10 a.m. to the 14th a.m., the Liangxiang district meat restaurant. At 9 a.m. to 10 p.m., the Doudian Jingxin supermarket and also the clinics. At 11 a.m. to 12 p.m., the specialties noodle restaurant. At 11 a.m. to 30 p.m., Sanren supermarket in the Doudian town. At the 14th p.m. to the 15th p.m., the Doudian communities. At the 15th p.m., Doudian Wangzhou village. On the 28th of April, the Xingyuan Cunjing community of Doudian town. At 12 a.m., Liulihe Jinshui Jiayuan community, the mutton restaurant. On the 27th of April, the Liangxiang Tiyuchang Road. The spots is going to be changed according to the dynamics. So here we remind all the citizens, please follow up the checkpoints issued by the city. If there is any overlapping of these checkpoints, please report to the community. The second information I want to bring to you is about the prevention and control of the COVID-19 pandemic. Please, we are also going to focusing on the Taihe Dalian Huoshao restaurant, the wedding ceremonies in the Yuzhuang village. We are going to accelerate the speed for the key spreading chains and the key personnel. For each one of the personnel, we are going to dispatch epidemiological research teams. After the detailed testings, yesterday there is a newly added 228 personnel, and the exclusion is still continue. Second, we are going to do a good job in the PCR testing. Yesterday, we have conducted the second round of the PCR testing, and tomorrow we are going to start the third round of the PCR test. So we here remind all the citizens, please follow the requirement, do a very good PPR protection. By now, we have locked 15 villages and 80 communities in the Fangshan district. For citizens who is quarantined to the quarantining areas, there might be a huge difference between their home and also the quarantining sites. This is also going to bring a lot of inconvenience. The contribution that you have made is laying the foundations for our future corporations. For these citizens who is living in the quarantine and also for the volunteers, we want to thank you. And currently, we are still at a critical phase for the prevention and control of COVID-19. And with the approaching of the Golden Week holidays, please follow the requirement and do a good PCR testing. And please actively inoculate the vaccines. Under your support, we are going to make all-out effort to cut the spread chains in this wave of COVID-19 pandemic. So thank you very much, Mr. Lu Chenfei. Now we are going to give the floor to Mr. Tang Yiyuan, who is bringing to you the prevention and control of the Tongzhou district. Friends from media, good afternoon. I'm bringing to you the latest information of Tongzhou district for the prevention and control of the COVID-19 pandemic. On the 28th of April, in Tongzhou district, the newly added case is 8 cases, among which 6 of them is related to the Jingmao Center, and 2 of them has an overlapping time with a confirmed case, and 1 of them is being screened during the PCR test. All of them has been transferred into the hospital, and according to their clinical research, they all belong to the PCR test. The first one is that the newly added checkpoints in our hospitals. On the 28th of April, at 7 a.m. to 8 a.m., 敬畏园 Noodle Restaurant. On the 24th April, Nancheng District, at 30 p.m. to 80 p.m., the public bus from Xiaopu Port to the Nancheng Xiang Port. On the 30th, on the 30 p.m., Sanmu Bookstore, and on the 40th p.m., taking the 808 back to the Baihewan station. On the 28th, on the 20th p.m. of April the 24th, using the public restaurant and as well as the delivery cabins. On April the 25th, collecting the delivery personnel, the delivery parcel from the delivery cabins. On April the 26th, at 16 p.m. in Yuqiao District, using the public restaurant. From the 14th p.m. to the 16th p.m. in the Xihai Garden of Tongzhou District. In the 16th p.m., working at the Luhe Hospital, the PCR testing point. Let me report to you the previous epidemiological history of the case number 2. Yangguang Xiyu Kindergarten in the Tongzhou District. The Wanda Supermarket on the April the 26th, and also the Zara store at Wanda Shopping Mall, and also the KFC stores and the Kentucky stores at the Wanda Shopping Mall, as well as the Cocoa Milkshake. Case number 3, on the April the 23rd, Jingmao Center, B1226, at around 12 a.m., Jinkelong Supermarket, from the 24th to 26th. using the public, the number, the patient is, the case is gathered at the number 8 building of the Tongzhou district. On April the 24th, the east part of the Tongzhou district, as well as the Jinshan Toubao noodle restaurant. On the 12 a.m., Tongzhou district OBGYN hospital, as well as the Xishangyuan vegetable market, Jiaolan Jiaren cosmetic stores. At 12 a.m., Lao Beijing steamed bread shop. At 6 a.m., from 7 a.m. to 9 p.m., Tongzhou OBGYN hospital. At 7 a.m. to 8 a.m., the Jinlong supermarket PCR checkpoints. At around 8:09 to 9:30, the Huochuntang areas. From 20 to 23rd, the Beiduan residential areas, the PCR checkpoints. Number 5, number 7 is scattered at their school. And for number 6, on April the 24th, April the 26th, from 6 a.m. to 7 p.m., is working at the residential selling areas of the Beihewan. At 13 p.m. in the vegetable supermarkets. At the 14th p.m., the PCR checkpoints in the Luhe Hospital. For those who is reminded by the Beijing Health Code, please report to the community and also report to the workplace as well as the hotels. Second, for the latest measures that we have taken to address the COVID-19 pandemic, our district government is using a very quick manner. From the 23rd of April, we have diagnosed 223 cases, which is the closed cases. At the same time, by now, across the district, we have drawn 23 different lockdown areas. And with the epidemiological rule-out, as well as the PCR result, we are going to adopt the relevant measures. At the same time, we are going to do a prevention and control in the risk areas, as well as the logistic and cleaning for the district. Thirdly, we are going to conduct a PCR testing. According to the overall arrangement in our district, we have conducted the second round of the overall PCR test. We have also arranged 2,884 medical workers who have finished 20,000 rounds of the PCR test. Fourthly, we have done a really good job. We have planned the online education platform for the different students who is in the lockdown region and the lockdown communities. We are talking with their parents and arrange their education schedule according to the household education as well as the remote education through the parents. We have bridged the effective communications as well as guaranteeing the concentrated areas for the different schools. We set up the gather up check place. And for the teachers, they should be the responsible person for the life and health of their patient. They are going to use the telephones to make sure that all the students is going to be careful every day. This is going to smooth the sentiment of the student. That is all I need to bring to you. Thank you very much, Mr. Tang from Tongzhou District. Now I am going to release you the mechanism of prevention and control for the Beijing Municipal Government's measures on the
防疫政策。
Golden Week holidays.
各位媒体朋友，为落实
Friends from
动态
media
清零总方针
To
和
implement the
4号要求
dynamic
切实
zero
防范
COVID
五一
policy
假期疫情
and
传播风险
prevent any potential any potential risk of COVID-19.
五一期间，市民群众
During the Golden
进入
Week holiday,
全市
all the
各类
citizens,
公共场所，包括
if
郊
they
区的
enter into any public
景区
space during the Golden Week holidays,
民宿
including the
的
tourist sites,
需持
restaurants,
48小时内
hotels,
核酸检测
and
阴
motels,
性证明
they should have
请
a
广大
negative
市民朋友
PCR result
严
within
格遵守
48 hours.
疫情防
Dear
控规
citizens,
定
please follow this
自觉
requirement
不前往中高风险地
and
区
voluntarily avoid to go to the medium and
保持
high risk
社交距
area.
离共同度过一
Keep a
个
social distance
健康、
to
安
make
全、
sure
祥和
that
的五一假日。五一假期后，
we are going to enjoy a smooth and healthy Golden Week holiday. After the Golden Week holiday,
48小时内
across the
核酸
city,
检测阴性证明
for those who are going to attend the school or attend the workplace, they should have a PCR negative result within 48
进行
hours.
核酸检测
Dear citizens, please follow the requirement
也要落
according
实
to the
防疫主体责任，严格查
and
验
for
核
all
酸
the
阴性
different
证明，
public
最大限
institutions,
度防范疫情风险，
healthcare
确保
institutions,
正常工
please
作
prevent
学
the
习秩序
potential risks to make sure that
下面
the
有请
normal order for day-to-day life
北
and
京
study.
新冠肺炎疫情防控工作领导小组检疫检测工作组副组长，北京
Now
市
we are
卫
going
生
to give
健
the
康
floor
委员会
to
副主任、新闻发言人李昂，
Deputy Director of
北京
the
市第二轮核酸筛查
CDC Beijing to report to you the result of the second round of the PCR test in Beijing. Dear friends from media, good afternoon. On the 28th of April and on the 28th of April, we have conducted a city-wide second round of the PCR test. Currently, we have collected 22 million personnel and all of them. And currently, there are 14 tubes which initially registered as positive, among which 2 of them is from Chaoyang District, 4 of them is coming from the temporary controlling regions, and 2 from Fengtai District and 2 from Fangshan District, 1 from Tongzhou District. For Haidian District, Changping District, and Daxing District, there is 1 tube which registered a positive result. We have conducted a similar measures, and this is also going to help us with the prevention and control of COVID-19, and it's also going to play a major role in the prevention and control of COVID-19. On the 28th of April and on the 30th of April, we are going to conduct the third round of the PCR test. We are at a critical period for the prevention and control. All the citizens, please follow up the measures and do a good PPE test, PPE protection, wear the medical mask, do not gather up, and keep a social distance. And please contribute your fair share effort to the prevention and control of the COVID-19 pandemic. This is my report. Thank you, Mr. Li Yang, for your latest information. Now the floor is going to be given up for questions. Before the questions, please identify your affiliated institutions. With CMG. So my question is given to Mr. Li Yang. There's 12 districts related to this wave of the COVID-19 pandemic in Beijing. How do you make sure that all the patients that is going to receive the medical treatment even in the lockdown region? Thank you very much for your question. I have summarized my experience into 3 sentences. The first one is quick response. The second one is to screen the key patients' demand for the communities and also for the lockdown regions. The lockdown is going to work together with the medical treatment. We should understand the patient with the demand for the tumor and the catalogical services, pregnant ladies, patient with the demand for the renal dialysis. We should understand the disease that they have caught, the medicines that they take regularly, as well as the medical institutions. to make sure that all the responsibility is going to be shared on each one of the person. Second, we are going to smooth the medical channels. According to the different backgrounds of the citizens, we are going to smooth the medical treatment. For those of the patients who have a fever, cough, or high temperature, as well as any upper respiratory symptoms, they are going to be sent into the hospital. For those without any respiratory-related symptoms, we are going to provide remote medical services to the patient. For those of the patients who need to be prescribed the drugs, we are going to provide the online prescription services, while the delivery services is going to be conducted by the communities. For those who is going to be transferred, we are going to transfer the patient in the community levels. The city experts is going to conduct remote diagnosis measures to support the patient. For those patients who need a regular treatment, the medical institutions is going to provide a continuous treatment. Thirdly, for the contact in the communities and also the head of the medical care centers in the communities, their telephone is going to be 24-hour open to the citizens. According to the requirement of the citizens, we are going to connect the medical resources. We have arranged the citizens and we have arranged the government officials. They are going to be work at the Beijing city. This is also going to help us to achieve a timely coordinated measures. For the severe patients, we are going to transfer them into the related medical institutions to make sure the safety and life of this patient. Moving into the next steps, the nosocomial infection work is going to work together with the emergency treatment measures. This is also going to help us with the emerging medical demand for these lockdown regions. And this is also going to help us to safeguard the health of the citizens in the capital city. So, with China News, the question is directed to Madam Pang. Is it necessary for us to pile up some of the medicines facing this unprecedented pandemic? Currently, we are conducting a series of the PCR tests across the city. This is going to help us to eliminate the potential risk and prevent the spread and control spread of the COVID-19. As you have mentioned, there are some of the netizens using the PCR result as a measure to pile up some of the medicines treating the fever. At the very beginning of this wave of the pandemic, a lot of citizens is coming to the supermarket and buy a lot of vegetables, among other grains. But under the coordinations of the municipal government, the food is in sufficient supply. And also the logistics is in a normal operation. So here we remind all the citizens that the medical institutions, as well as the pharmacies, and also the upstream wholesale companies, including the Lianhua Qingmeng capsules, is in sufficient supply. There is no risk for any cut down of these medicines. It also can satisfy the demand of the citizens. So here I want to remind you once again that the medicine is nothing like daily necessities. Medicine, for each one of the medicines, it has its complications. And there are the effective period or the shelf life of the medicines as well as the side effect. For those of the citizens who is in real demand, they should come to the hospitals and get the treatment. While you are buying some of the medicines, please follow the clinical guideline as well as the prescriptions of the doctors. Do not buy it on purpose. Do not buy it voluntarily. Thank you.
那提问环节到此结束。
Thank you very much. We have concluded the Q&A sessions. Thank you very much for you joining us with us today. This concludes today's press conference.